12:17 on my clock here, and we've got 6 of the 7 board members on the meeting. So I will. This
James
is Ross
is here as well.
Okay, we got James. We got 7 of 7. Thanks, James. So this is Ross Miller, chairman of the Missoula City County Board of Health. I'm going to go ahead and convene the meeting. As some preliminary matters, we are going to strike all items on the agenda with the exception of item number 3, which is the action on staff recommendation to adopt board rule mandating use of cloth face coverings in public. We're also going to cancel the Air Pollution Control Board meeting. So the entire meeting will be dedicated strictly to item number 3, the face coverings rule. So with that, I'm going to turn it over for a couple of minutes for some preliminaries to Emmy Bristol. As you all know, we're doing this meeting remotely. So there's some technological challenges and considerations, of course. And Emmy's going to take a couple minutes and go through the technology, kind of lay out some technology guidelines and ground rules, if you will, to help us move this meeting along a little smoother. So Emmy, why don't you take it from here for a couple minutes?
Thanks, Ross. Yep, I'm Emmy, and I'm just going to do a quick overview of some technical information so our meeting runs as smoothly as possible today. First off, this meeting is being recorded, so know that everything being said here is part of the public record. Please mute your microphones. If you do not do so, we will mute you to make sure there is no background noise or feedback. Please turn your camera off to help limit technological issues. Also, this way you will not show up embarrassingly on the public video recording. This is being live streamed on MCAT. To view it, go to www.mcat.org and under the tab labeled Watch, choose Local Live. This is also being aired on Charter Spectrum's Channel 190. Please note there is a 45-second lag time on these channels. If you are watching on MCAT and wish to provide comment, please send your comments to the Health Department's comment portal. You can find it by visiting the Missoula County website and clicking the link at the top labeled Submit Public Comment on Proposed Rule. If you are only on the Teams meeting to watch and not provide comment, please exit this Teams meeting and go to MCAT's website to watch. This will help limit technological issues we may face on Teams. If you wish to provide a simple yes or no regarding the mask order, please feel free to leave your comment in the chat box. We will include those as part of the public record. Once you have done so, feel free to exit the meeting. If you still choose to watch the whole meeting, you can do so on MCAT's Local Live or Channel 190. If you wish to leave a full verbal comment in this meeting, we will try to give you a chance, but time limitations may preclude your ability to comment. To more easily help us with tracking who all has comments, if you are on the phones, please consider calling in directly to Teams. If you do not have the Teams application, you can use the web browser. When you click the link to the meeting found on the agenda, you will have the option to either download the app or join on the web. If you choose join on the web, it will bring you straight to the meeting, though the application tends to work best. You can also do this on your smartphone. If you are already directly called into the Teams meeting, when the comment period opens, we ask that you use the hand-raising feature in Teams located on the gray taskbar that appears when you move your cursor. This will help us track who to call on for comments. You will need to unmute yourself before speaking. Due to time constraints, we will likely not get to everyone's comment. If the hand-raising option does not show up for you, please comment in the chat that you are raising your hand when the comment period opens, and we will make sure to call on you. Remember to unmute yourself before speaking. Again, due to time constraints, we will likely not get to everyone's comment. If you are on the phones, we will make sure to go down the list of phone numbers to call on you. Please be attentive when your phone number is called out and unmute yourself before speaking. Once again, due to time constraints, we will likely not get to everyone's comments. And due to the volume, all comments will be limited to 2 minutes. And we will give 20 minutes to both proponents and opponents of the order to comment via Teams, and 5 minutes for those participating via phone. That's all I have. With that, I'm going to pass it on to Cindy Farr.
Excuse me, this is Ellen. We're getting a lot of chat comments. We also have some some visitors who have their camera on. If you could please turn your camera off. If you're not a speaker. Susan, thank you. Okay.
And Ellen, are you going to share the slides?
Emmy will have to share yours if you're not able to share yours. And Emmy does have them all, and Cindy's is slide number 1.
Emmy, would you mind sharing that, please?
No problem. I'll get them up real quick here.
While that's going up, I will add to Chairman Ross's comment about the agenda. We will have the agenda item for public comments for items that are not on the agenda. That is normally required, and that is listed, and that'll be at the very end of this meeting. Thank you.
Thanks, Ellen, and thanks, Emmy. So this is just a little very short briefing of what COVID-19 looks like here in Missoula County as of 5 p.m. last night. So we had 126 cumulative cases, 56 active cases, 510 close contacts currently, which is up about 200 since yesterday. That number was updated this morning. So if you look at this chart here, you can see that we've got COVID-19 cases by age, and the vast majority of our cases are in people that are under the age of 40, which is generally pretty good, because that one thing that means is that, you know, generally people under 40 are very healthy, and so they're not having poor outcomes from this disease. And so we're glad that we're able to keep it out of our older adult populations at this time. If we look at the source of exposure right now, more than half of our cases are contacts to a confirmed case. And the majority of those are contacts to a confirmed case in Missoula County. They're not contacts to out of state or out of county cases. We do have a few of those, but the majority of those that are contacts to cases are contacts to cases here in Missoula. We've got almost a quarter of our cases are community spread at this time, and a little fewer than that are related to travel. So what this is telling us is that we are still able to track our close contacts, get them tested. We're not seeing a huge amount of community spread at this time, but we are seeing a lot of clusters. So that's the next pie chart down at the bottom. So the 59% are not clusters. And if I define a cluster, it basically means that we can identify those cases that are either related to each other due to an event or a location. Most of our clusters have been located in workplaces. So that is, you know, the one thing that message that we do want to get out to people is that, you know, we're spreading it amongst ourselves. And it is your family, friends, and loved ones that you can give this to. And that is the trend that we are seeing right now. So with that, I will pass it on to Ellen.
Thanks, Cindy. So yeah, go ahead, Ellen.
Emmy, yeah, don't share the slide yet. I'm sorry. So this is Ellen Leahy. I'm the health officer and the director of the Missoula City County Health Department. I am today recommending that the Missoula City County Board of Health adopt the proposed rule for a required mask or face covering rule. And in companion to that, after this hearing, depending on how the board amends or does adopt, I will also use the authority of the health officer under Title 50 to adopt a health order matching that rule. That authority also comes with the duty to control the spread of communicable disease, and that's a lot of what this whole pandemic is about. So we would be using all of our Title 50 authorities to try to improve the mask use in the community. In April, at Chairman Ross Miller's initiative, this board took up the mask question, and upon discussion and input came out with a strong recommendation to use masks. We had hoped that we in the community would be able to increase the normal use of masks to a widespread use. And it is the widest use possible that CDC recommends is necessary to prevent the widespread COVID cases. Unfortunately, although a lot of people are trying and a lot of businesses are trying to require masks, we have been called upon, and it is clearly indicated that it's going to take more of a mandate to support those that are trying and those that do wish to go out and not be unnecessarily exposed to someone else's germs, since they could be COVID. We do know that our cases are up and they are continuing to go up. Our number of contacts are going up. So at the urging of our health board earlier, of our leaders who will speak and have written to the health board and to me and to the public, whom you will hear their summary comments from, I do recommend this proposed rule. I would like to say that the idea of wearing a mask to prevent the spread of disease is not a new idea. It exists in the clinical setting, in the walk-in setting, every year when it's the season for respiratory diseases. So this rule gets at people that wear the mask in order to not further spread disease, in this case, COVID-19. It absorbs some of the respiratory droplets that would spread. And it also cuts down on some of the propulsion that comes from talking, coughing, all those types of things that spread respiratory droplets. So it is not a new idea. You see, take a mask every flu season, but we are trying to make widespread use of this pretty simple concept because COVID is contagious, and unfortunately, it can be most contagious 2 days before a person even knows that they have symptoms. So by the time you know you have it, if you do not have an asymptomatic case, you may have already spread it at your workplace and in the public. In addition, there's no treatment, curative treatment, and there's no vaccine. So we have to use these types of measures. If we could go to the first slide just briefly, please. Or it's actually slide number 2. I'd just like you to look at our first small spike of cases on the left side of this epi profile. The vertical lines that you see, the second one in is when we were given the governor's shelter-in-place order. And as you can see, those cases did not continue to spike up. Then the phase 1 reopened. There were no cases by that time. We had smothered the disease. There was no eruption of disease from phase 1 until we were well into phase 2. And then as you can see to the right, we are having a spike. I believe this is a spike that will continue into a higher number of cases. And in fact, because it takes a week to 2 to show up, you can't even see all the cases that are currently incubating at this time. So while we were, if you could take the slide down, please. While we were closed down and first opening, we were all staying apart, and the disease couldn't spread. And this, we can't stay closed down forever, but we also can't get real close together in normal fashion. So masking, distancing, reducing spread, and sanitation are the tools that we have. Those are our tools. We are currently really lacking in masking. And so therefore, we propose this rule. If you could just why do we propose, what will this give us? Some people will say, well, the cases are going to happen anyhow, even if they happen later, or the cases aren't as deadly, or the numbers are small. Well, that's the point. The numbers are small, and to keep them small and manageable, this is a necessary action. What we're really doing here is we're trying to buy time. If you look at the cases that we didn't have between April and July, and the last time that the board looked at a board rule, in the time that was bought, look at the advances that were made on this disease. Testing became available. We are able to identify and control very minor cases of the disease and stop the spread to higher risk people or to more people. We've been able to implement local plans so that we do things differently. We've let the governor has let our businesses to open up. We have not overrun our healthcare system. Our clinicians know better what to do versus what not to do than they were able to know 3 months ago. We have trials of antivirals underway that can help treat the disease. There are actually vaccines in trials. And we are up and open not only for business, but for necessary services. That is what buying time brings us. And widespread mask use is an important part. The second or third slide, please, Emmy, and I will end. The rule, in terms of interpretation, is really pretty simple. There are 4 conditions that, if they're all met, a face covering. It can be a mask, it can be one like is shown on the screen here, it can be a kerchief, it can be a buff around the neck that you pull up over your nose and mouth. With these 4 conditions, anywhere in Missoula County, indoors is the second condition. Indoors in a place where the public is either required or invited to attend, and I put a bus there to show you this includes public transportation and ride services. And for anyone 12 or older, then the requirement applies to you. You must wear a mask in that situation. Thank you.
Okay, thank you, Ellen. Now we're gonna turn it over to Deputy County Attorney Anna Conley to present the authorities that underpin this enforcement action. Go ahead, Anna.
Thanks, Ross. I was asked by the health officer to talk about 2 things briefly: the authority with regard to this order and enforcement of this order. So this order is being looked at as both a health board rule under Montana Code Annotated 52116 and a health officer order under 52118. Next slide, please, Emmy. So with regard to the health officer order, as Ellen mentioned, health officer is required under state law to do a number of things. I've listed here 2 things that the health officer is required to do, including make inspections for conditions of public health importance and issue written orders for compliance or for correction, destruction, or removal of the condition. A second requirement of the health officer is to take steps to limit contact between people in order to protect the public health from imminent threats, including but not limited to ordering the closure of buildings or facilities where people congregate and canceling events. Next slide, please, Emmy. So with regard to this board's authority to issue this proposed rule, this authority stems from 52116, and I have listed a few of the requirements of the board under that statute. Those include to institute isolation and quarantine measures, to ensure abatement of public health nuisances, to take other public health measures as allowed by law, to protect the public from the introduction and spread of communicable disease or other conditions of public health importance, including through actions to ensure the removal of filth or other contaminants that might cause disease or adversely affect public health, and to supervise or make inspections for conditions of public health importance and issue written orders for compliance or for correction, destruction, or removal of conditions. So those are the 2 statutory bases of authority for this proposed action today. Next slide, please, Emmy. So with regard to enforcement, this rule and order is directed not at individuals, but at businesses and operators of indoor public spaces. The idea of this rule is to regulate an indoor space, not regulate an individual's actions, and to ensure that indoor spaces are safe for all those who enter them, including employees and patrons, for example. It does not create an individual requirement for a person to wear a mask, and therefore an individual who refuses to wear a mask cannot be subject to criminal penalty under this rule and order. So if a business or an indoor public space operator refuses to enforce this requirement, there's going to be a number of steps taken by the health department. This is a complaint-based approach. So the first step would need to be that the health department would receive a complaint about a business or indoor public space. As we've seen the last few months, the health department will then do outreach, ensure that the business or operator is aware of this mandate and able to follow it. The next step would be, if the operator is aware of the mandate and able to follow it, a potential warning by the health department to follow the mandate. If after a warning, the business or operator continued to refuse to comply with the mandate, the next possible step would be a health officer order. You may be familiar with health officer orders in the context of a restaurant. If a restaurant is operating with a kitchen that is so unsanitary that it's not safe for the public to eat there, that particular restaurant may be closed through a health officer closure order. So the possibility of that type of order is on the table also. And it is possible that if a business refused to close or comply after a health officer order, that a civil action may be taken to enforce that order. Next slide, please, Emmy. So what I just described with regard to the health officer closure order is set forth in 52.123. And then also I just want to talk very briefly about the possibility of criminal sanction. Again, I want to reiterate that this order as drafted does not apply to individual citizens. It is possible under 52.124 sub 1 that a person could be found guilty of a misdemeanor and be fined with no jail time between $10 and $200. So for example, if a business owner were cited by law enforcement for failure to comply with this order, then this subsection may apply because that person is failing to keep a public space safe. But again, this would not apply to individuals who refuse to wear a mask. And it would require, the first step would be that a law enforcement officer would cite a business or a public space operator. That's all I have. Thank you.
All right, thank you, Anna. With that, we are gonna start our board discussion phase of our meeting. Due to time constraints, we're gonna have to limit the board discussion to about 20 minutes. Then after the board discussion, if we get a motion on the floor, then we will move to public comments on that motion. So with that, I will open it up to board discussion on the proposed rule. Any board members want to start the discussion?
I have a question for Ellen. This is Pam. I was wondering why the age cutoff was set at 12 years of age.
We based our rule on the recently enacted Oregon state rule, and we looked at other rules, and they tended to look at age 12. I do want to mention that children under age 2 should not be masked. So in terms of being consistent with some others that have actually gone out and done this before we're trying to learn from that. We also believe that at that age, that might be the age where some children are actually out and about on their own with various activities, might go into a store, might go into a mall. and also fully capable of the instruction and the ability to handle the mask and not have someone else needing to handle it for them, which actually could cause some contamination issues.
All right, thanks, Ellen, and thanks, Pam. Any other discussion from the board?
Ross, this is Josh. I just had a quick question.
Yeah, go ahead, Josh.
Thanks. Is it possible to build into this a revisit date that if we are to enact this, we look at it again in X number of weeks to survey the situation at that point in Missoula County to decide if we want to continue on? Is something like that possible?
Thanks, Josh. I guess that sounds like a question that would probably be best handled by Ellen and or Anna.
Anna.
Yeah, Josh, you can certainly move to amend the draft rule to include that language.
Great, thanks. Ellen, this is Josh again. If we were to do that, when do you think we would want to reconsider this, just to survey the situation in Missoula County? How do we build? What do you think would be a reasonable amount of time?
Well, it's very difficult to know when we'll have a change where we have something more protective, such as a vaccine. So it could be, several months. We'll be going into the indoor and winter cold and flu and RSV season. So I would say several months. Then we would need to gather the board. So I wouldn't do it before next January. Now that doesn't, to put a review date on there does not preclude us from reviewing earlier. It absolutely does not. But to put a review date on there that's really kind of too early, then you would have to convene the board simply to do that review.
Mm-hmm. Okay, thanks.
This is James. My kind of chime in from the board positioning is I'd rather leave it up to the discretion of the health officer on when that appropriate timing is for now, just because there are so many unknowns with the illness.
Thanks, James. This is Ross, and to kind of chime in on that as well, the Board of Health does meet regularly once a month. So I envision that we'll, at a minimum, be getting a briefing and an update on a monthly basis. So we've got that going for us, that we're going to be keeping up with this and keeping track of it, so that when it's time to use discretion, we're going to be up to date on what's going on.
That's good, Ross. Thank you thanks for that reminder.
This is Amber. Cheryl, also, I wanted to talk a little more about what Pam brought up, is the age, the 12 and under. And I do understand that at 12 and up, sometimes they're on their own, but they're also, as a mother of two daughters, they are with the parent a lot when they're younger. And maybe I'm wrong on this, but I believe that there was some evidence out there that kids could be super spreaders. And could you speak to that more? My main concern with how this is written is there is no requirement for 12 and under. So could we speak to that a little more as far as?
Yes. 12 is not a magic number in terms of evidence related to the effectiveness of the mask. It's just a much more practical number for that purpose. I don't have evidence either way that children are super spreaders. So I do want to point out that there are a lot of settings that children are in that would be covered by this. So that would bring both more protection in those settings and also more practical considerations for those settings in order to comply. So really, we went with 12 because that is our first stab. We're looking at indoor places in our community, and we were just looking at what others have had a little bit of experience with.
All right, thanks, Ellen. Was there, on the age 12, was there consideration given to implementing this in school settings?
Actually, yes, thank you for bringing that up. By definition, meaning those are indoor, they are in Missoula County. The public is in fact not only welcome, but required to be there. It would then cover the elementary schools. Age 12, we get into the middle schools, and there is some literature about at least requiring it from middle school on up. There's mixed information about what it would take and would not preclude a school district from requiring it all the way down to age or first grade. But at 12, it allows the school district to consider if they're going to go down to those earlier ages. We also did not post it at a younger age, and I think if we had, we perhaps would have gotten some different comments that we did not receive. So as a process question at this point, we do have to consider that.
All right. Thanks, Ellen. Do you have any follow-up with that discussion topic, Amber?
Yeah, I mean, I definitely see Ellen's point because we did not post it, and I think that the public has the right to comment on all of these. So I do see that. I'm a big proponent of doing this, and I think that it feels like from 2 to 12 to not have kids in masks in grocery stores and things is a pretty significant breach in what we're trying to control. And so I have some heartburn over that, you know, and I know that my kids were with me out in public more when they were under 12. And so as a parent, I was able to control that more, would have been able to control it more. So I just want it noted that I think my personal thought is that we need to do this. And so I'll be voting in favor of it. But I do have some heartburn over that.
All right. Thanks, Amber. And I definitely share your concerns. One thing, just like a couple months ago, when we passed a strong recommendation for wearing facial coverings, was our goal was to try to normalize face masking and face covering as much as possible. And so hopefully what we'll see with this rule, if we pass it, an order, if Ellen signs such an order, is kind of continued normalization of wearing masks and face coverings, and we'll see how it goes with children under 12. I mean, hopefully it'll become normalized, so we see a lot of children under 12 wearing masks when they're out in grocery stores with their parents. But I guess that's something that we'll see.
Right. And I would just like to also add that, I think that at any opportunity that we, assuming this does pass today, that we have to make sure people don't believe that from 2 to 12, there's any health concern with them wearing masks. That's another thing that if we say 12, that, there may be some misinformation out there that they shouldn't be wearing a mask if they're under 12. And so whatever we can do, just to make sure people don't believe that would be great.
Yeah,
This is
no,
Jen.
understood.
I'm seeing, this is Ellen, I'm seeing, again, it's at this point more of a public, it was pragmatic on our part, and it's more of a public notice issue at the current process that we're in. And I see a chat from Dr. Stenger about the percent of cases in Missoula that are under 12. That is a fairly small number. Of course, this is preventive, and we're trying to prevent that. I know schools are also preparing for what they're going to do in their own school. And I think they and we will then learn from how they're approaching this. And Cindy is saying on the chat that 0.05% of our current cases are under age 12. Thank you.
This is Pam, and so just a point about that is that children tend to be less symptomatic and in often cases asymptomatic. And so the reason we may not be seeing a higher number of cases is because we have not been doing a great deal of asymptomatic testing in that age group. So just bear that in mind.
Yeah.
And I
Good
would
point.
just also add that this does not preclude any business who wants to not worry about that age and just say, you know, in our business, we're not going to stand there and look at the age. You're all going to wear a mask. Please do that.
So is there some way in the order to make that clear that we strongly encourage children under the or between the ages of 2 and 12 to wear masks? Can we say something in there about that?
Yes. In the health officer's order, I can add recommendations to it, and I can easily do that. We will also message that throughout our entire public information campaign.
Okay.
This is James. If the board does vote for, implementing this order, I'd like to request that the health department put together an FAQ or some kind of guidance pamphlet, document, whatever, on a lot of these questions that are being asked about masks, like is it safe to wear under a certain age, all that kind of stuff. It'd be really nice to have that. So there's a quick kind of fact check, because there's a lot of misinformation about masks and communicable disease spread going on right now throughout the United States. So it'd be nice to have an FAQ or something like that, or a brochure that could kind of easily answer people's questions if we decide to vote yes on this order.
This is Ellen. Absolutely. Thank you for that recommendation.
All right. Yeah, thanks, James.
Ross, if you would like a motion, I'd be happy to make it. This is Amber.
Sure. And if you could include in your motion, I don't believe at this point that I've heard any amendments to the proposed order, but if there is, if you could go ahead and include that in your motion, Amber.
Hang on, Ross. This is Josh. Are we, in terms of process, should we be hearing some public comment or synopsis of public comment before we make a motion and vote on that motion? Or would it be after the motion?
Good question, Josh. I'm glad you asked that, because I think the public is going to be pretty interested in the answer to this. So our process has always been that we put a motion on the floor, and at that point, before we vote on the motion, we open it up to public comment. The reason we do it that way is so that the public knows exactly what they're commenting on. And for the very reason that we've just been discussing, in case a proposed rule or action gets amended through discussion, so that amendment is put in the motion, so that then the public knows exactly what the motion is when they go to make comment on it. So yeah, the correct order of process is to go ahead and make a motion. At that point, start the public comment process. After public comment, then we vote.
Thank you.
You bet.
So would you like me to, I've only got one screen here, so I'm trying to go back to, would you like me to read the motion? Or is it sufficient to say the motion as presented?
Let's ask Anna Connolly that question.
Can I clarify that you're not proposing any amendments?
I don't think at this point we're proposing any amendments unless, right, Ross, unless someone would like to make one.
I have not heard an actual amendment so far. I've heard some discussion on potential amendments, but I haven't heard an amendment proposed yet.
I think if you're not amending the motion, or you're not amending the draft I think the draft is part of the agenda and it's fairly long, so I don't think you need to read it if that's the question.
Okay, good, because I thought it was really long as well. Could I need to understand one more thing before, because I may make an amendment and then we can see what the rest of the board thinks about it. So I'm a little confused with what the process for public notification is as far as making an amendment, if I was to make an amendment to the age. Could you clarify that for me a little bit, Ellen? I was confused with what you said.
I guess I would leave it to Anna to advise the board if an amendment was significant enough that it, had it been put forward publicly first, if it would have drawn more comment. My opinion on that, knowing that we're working with the schools right now for reopening and understanding that they just got their guidance last week and trying to understand the various settings, I would find that to be significant. If whether that's legally significant or not, Anna would have to advise you.
I agree with Ellen that I believe it would be significant to change the age. There may be parents of children within that age group that may have wanted to comment that are not able to do so because of the process if the amendment comes today.
And this is Ross. I would agree with that as well. I'm basing my agreement on kind of a preliminary review of comments that that we received and that I was able to look at last night, and looking at about, it was a little under 1,200 comments. Most of the, I should say, a huge portion of the opponent comments were based on age of children, and actually this rule and order as proposed takes care of those comments. There was just a large number of comments to the effect that I run a childcare business and you can't keep face masks on 2-year-olds or 3-year-olds. And so I'm just agreeing with Anna and Ellen that I think it would be a very significant change that would kind of go counter to what we've got publicly noticed.
Okay, then I would like to make the, I appreciate those thoughts and information from everyone. I would like to make the motion without any amendments as proposed.
All right, thank you, Amber. We've got a motion on the floor. I'll point out that that motion came in exactly 20 minutes after we started our discussion, so good job. So with that, we're going to open it up to public comment. Emmy Bristow is going to help me and help us with the technology and kind of shepherding the public comment, if you will, or I should say, better term would be kind of organizing it and keeping track of it. So how we're going to...
Ross, excuse me, this is Ellen.
I think I know what you're just...
Because so much public comment was deliberately collected electronically to allow people to bring comment in, and we did get several thousand. Our public information officer, Mary Parrish, is prepared to summarize that and then open it for additional public comment.
Good catch, Ellen. I was jumping ahead of the agenda here. So thanks for joining us, Mary, and go ahead. The floor is yours.
Yeah, you bet. Thank you so much. So again, my name is Mary Parrish. I'm the Public Information Officer for the COVID-19 response. When I'm not serving in this role, I am the Accreditation and Workforce Development Coordinator, so you might know me from some of my duties pre-COVID. I'm going to share my screen with you. Okay. All right, can someone just give me a verbal confirm that they're seeing the presentation?
Yes.
Thank you. Okay, so I am going to present public comment. So we collected information and comments from the public via our feedback portal. That portal was first created when we first wanted to collect public comment a few months ago when we were discussing reopening. So that portal has been live and active for a while. We've been capturing information coming in this entire time. I will say that for the purposes of this presentation, we are presenting data from the June 25th, 2020 through July 8th, 2020. That includes the time frame in which we specifically solicited comment and kind of a week and a half prior when I would say the community, media, so on and so forth really started bringing some light to the issue of wearing a mask or cloth face covering. And so we just started to see public comment coming in right around that time. I will say, just to provide some context, we received a lot of comments before we actually solicited comment on Tuesday, July 7th at about 1000 hours. That's when we sent out a press release explaining about this special Board of Health meeting, its purpose, and when the public could submit comment and how to submit that comment. We let folks know that we would do our darndest to track all that data and present to the Board of Health today. That being said, first and foremost, this is a very, very big thank you. It's amazing to see this much engagement from our community. I really appreciate that you checked in, touched base, and shared your voice with us. I will say we received an overwhelming amount of public feedback, and we really could not have anticipated that. I knew that this was a pretty well talked about topic, but I don't know that we could have anticipated the sheer volume that we got. We had things come in from the portal, direct email, direct phone calls, and letters. And again, I just wanted to provide a little bit of context about really where we're at right now. We had some technical difficulties, and I'm sharing all of this to be transparent. When we did finally get tech issues sorted out, I share this as an example. We had about 24 person hours yesterday, and across those hours, they were able to track 1,200 comments, which is pretty awesome. But again, we were kind of working with some technical difficulties, and I think the system was also a little overwhelmed itself, just accepting that volume of comment. So I really want to emphasize all of this public comment is public information. However, we are not yet finished tracking all of it related to this proposal. As Ross indicated, we sent the Board of Health what we had yesterday afternoon so that they could start reviewing this information. We're kind of doing the same thing right now. The Board of Health received another document this morning that was more comprehensive. It captures 2,577 comments that we were able to track. That being said, we did kind of have to take a pause so that, one, we could be prepared to speak coherently today to you and present this information and package it in a way that is easy to understand. And so I want to let you know, like, just because I'm not presenting the full picture of public comment does not mean that it is not available for public consumption. It's just that we're doing our best to work through that high volume of comments that have come in. All right, now let's get into some more details. I wanted to share this piece of information just to demonstrate kind of how we really could not have anticipated this volume of public comment coming in. So the portal has been open since April 22nd, and you see between April 22nd and June 24th, 64 days, we had 454 comments. And then when you look at just 2 weeks, we had 4,029 comments come in. And here I indicated of those 4,000, we were able to track, which means we've put them into a spreadsheet, categorized them, and we were able to track 2,577 of those, or about 64%. Within the remaining time frame, we had almost 1,400 to 1,500 more comments come in between, midday yesterday and 5 p.m. yesterday. People on PIO team and support staff continue entering that data. It is being tracked. It's just this is where we are at this particular moment. And I will let you know that at 8:30 we had 300 more comments. So I imagine there could be up to 400 by now. Okay, and this is what we're interested in. So public comment by place of residency, we track whether someone is in city, county, whether they didn't indicate or whether they were out of county. So of the 2,577 comments we tracked, you'll see that almost all of them are city and then county. Some did not indicate, some in orange were out of county. So first I'm going to go through the city feedback. So city, when we look at folks that submitted comment during this 2-week period, kind of when we were talking about the proposed mask rule and masks and face coverings, there were about 1,664 comments in that time period from city residents. Of those, 1,345 were a proponent of, 206 were opposed to, and 113 folks submitted comment that was unrelated to the mask rule. That is not surprising because that's a portal that we use for all kinds of feedback. So it could be for someone has a question, they need a clarification, or they're letting us know about, let's say, an establishment that they have some concerns about. When we move into just looking at the folks that are from the city that specifically indicated yay or nay, we see that 87% of city residents were proponents and 13% were not. Then we look at the county. The county, it's kind of interesting, you know, just if you're really into research and data, this was kind of fun for me to see the difference between city and county. So we had 656 county residents, of which 397 were proponents, 194 opposed, 64 again submitted unrelated comments. So then again, I did the same thing. If we just look at those 591 people that submitted information giving either a yay or nay, we see that 67% of county residents were proponents of the proposal and 33% opposed. Okay, so now we're just going to compile that data together because I want you to get a full picture of all city, all county residents that commented. Of the whole there, we have 2,142. You see 81% are proponents, 19% are opposed. Now this, I just want to say, this is data that was gleaned. This is essentially, I didn't go through and do a very intensive research analysis in the way that you would do if you had more time, but I will say we saw lots of comments from residents, non-residents, citizens, business owners, healthcare specialists, government, educators, schools, and elected officials. And I'm sure we're really interested in some of the why. So why are the proponents for this? Why are opponents against it? This is, again, just a general sense of, after having looked through all of the data, kind of the things that rose to the surface. So proponents were really citing scientific evidence, as well as this is kind of indicating that, hey, this seems to me like something that's minimally invasive, relatively easy. It's the kind, respectful thing to do to keep COVID in check. And there was some pretty good understanding that this is not to replace anything that is already in existence, like the social distancing, the cleaning, disinfecting, but it's used in addition to, knowing that the mask is not the be all and end all, but it's a piece of the safety protocol. Then when we look at the opponents, again, they're citing scientific evidence for their reasoning to oppose the proposal. And this is from me. This is my interpretation as a community health specialist and an educator and a researcher. Some of these seem very valid, that they were concerned for folks with pre-existing conditions, mental health conditions, so on and so forth. And I would say I'm pretty sure that there is lots of flexibility in this rule for those folks with pre-existing health conditions. Some of that scientific evidence that was cited reads to me like it's more misinformation and misunderstanding. We still, and I see these as opportunities for education and outreach, really. That's how I'm interpreting this. They're still trying to get folks to fully understand that the mask on your face is for someone else. Some folks still think the mask is for you, and that's really not the way that mask works. And also some folks were just indicating, hey, we don't really have the number of active cases right now to merit this kind of a response. Also, overwhelmingly, there were a lot of opposition citing civil liberties or, federal government overreach, things of that nature. And then additionally, lots of comments about concern over enforcement. And that wasn't whether or not it would be enforced, but really to me, when I read that, it was more of the idea that this is going to be really hard to enforce. And so they were like, it's kind of wishy-washy, like I could see this being a good thing, but it's not going to be a good thing if there's no weight behind it. Okay, almost done here. I wanted to show you a quick example of the elected officials, schools, clinics, hospitals, so on and so forth that submitted formal letters to us. As you can see, there is pretty overwhelming support from some really important elected officials. We have support from MCPS and the University of Montana, The 3 main hospitals here and clinics in town are proponents of this: Community Partnership, Providence St. Pat's, Missoula Economic Partnership, Montana Restaurant Association is for this as well, Missoula Aging Services, the Art Museum, and then some businesses down here, Good Food Store, Imagination, and Jimmy John's. I do just want to highlight this childcare daycare because this also reinforces the conversation, or gets to the conversation that we've been having. And kind of what Ross indicated, that when he was first reading through the comments, it seemed like people were for this, but with some caveats. And so all of the childcare daycare comments that we received, and were able to record up to this point, to me, they really indicated that they were actually in favor of some kind of mask requirement, but not in their childcare facilities. And so a lot of their considerations were around those issues of age and like saying that, you know, really, really little ones aren't going to be able to do this. And to that, I would say, hey, you're not wrong. That's why we've made the age 12 years old and older, knowing that, as Ellen said, that's kind of a practical age to kind of initiate or ask folks to start wearing the mask. There was, I do want to be very explicit, there was one childcare agency that said they were fully against, I apologize, this Y for Fort Courage Childcare, they were a full-on yes. And then I know that one of these was a full-on no, so I apologize, there's a typo here, but one of them was a full-on yes, I support this outside of my facility, inside my facility, and one of these was a full-on no, and they cited civil liberty as the reason why. And that is what I have for you. I will also just let you know really quickly that the Board of Health has this presentation. The Board of Health has also a sheet from our call center that indicates the calls that we've had from 6:25 through 7:08 and the topics that were discussed. As well as they have the spreadsheet that includes all of those 2,577 comments that have been recorded thus far. Thank you.
All right, thank you very much, Mary. With that, I'm gonna move into the public comment phase of the meeting, and I'll be opening it up for public comment. But again, because of our technology requirements and that this is a virtual meeting, we got to have a little bit of ground rules, and Emmy might chime in a little bit when I'm done here to kind of provide some guidance as well. But in general, what we're going to do is we're going to open it up for public comments from proponents for 20 minutes, and then we're going to open it up for public comments from opponents for 20 minutes. And those would be opponents and proponents that are joining us on the Teams application, so that they've got, they're in other words, not calling in on their phones, but calling in on Teams. The reason for that is because if you're using Teams, we can see whether you're raising your hand or not, because we have a raise hand function, and Emily can help determine who's a proponent and wants to speak, and then who's a proponent and wants to speak. Then after we go through the 20 minutes each for proponents and opponents that are attending via Teams, we will then shift to a few minutes for public comments from participants that are on just by their phones. So we're going to try to give, I mean, probably not everybody's going to have a chance to speak because of time constraints. But with that, Emily, do you want to kind of get us started here with our 20 minutes of proponents, and do you want to lay some ground rules a little bit to start us off?
Yeah, so if you, just for those on the phone who maybe don't quite know how to join on Teams, you don't have to have the application. You can join on the web. Just follow the, are we okay? Okay. Just follow the link on the website or on the agenda that you have for this meeting, and it should open it up. It'll give you the option to either download the app or join on the web. If you join on the web, it'll bring you straight to this meeting. So you can even do that on your smartphone. So if there are those of you on the phone who want to make sure you definitely get time to speak, that's a good way to probably do that. So I guess I will go ahead and start raising your hands if you are a proponent, and I'll go down the line and call on you.
Okay, and this is Ross again. While proponents are raising their hands, I need to mention that due to the time constraints, we're gonna provide just a 2-minute time frame to present your comments. I've got a little timer here. I've got a little, I got a little bell. And so after 2 minutes, you'll hear the timer go off, and when I ring the bell, that means basically that Emmy's gonna mute your mic so we can move on to the next speaker. So with that, go ahead and select a commenter, Emmy.
Yeah, and one more thing, if you do not have the most updated version of Teams where you can't raise your hand, please just leave a comment in the chat saying, I'm raising my hand, or, I have a comment. So I'll make sure to check both. So let me just see. Okay, it looks like the first comment I see is from Madeline, who says she's a proponent, but also has a question. Would this be the point to bring that up? Ross, do you want to address that?
I guess the answer would be yeah. I mean, if you've got a comment and a question, go ahead. I mean, you can use your 2 minutes that way. Keeping in mind that at this point, yep, that's it.
Okay, so Madeline, do you have a comment? You can unmute yourself.
Okay, thank you. Yeah, first I wanted to say that I'm very much in favor of this, and I'm glad to hear that a majority of Missoulians feel the same. I think that it's really important that we take the step to do what we can to reduce the spread of this disease. And my question was, I noticed you mentioned that it's not an individual requirement. There's no action there, there's no penalties that are going to go against individuals who refuse to wear a mask, which I get. My question is, because the aim is on citing businesses, for instance, what support is going to be given to businesses when there's a customer who refuses to wear a mask indoors? Because I know that in other places there have been incidents where people have gotten violent when the store workers are trying to ask them to either wear a mask or leave. And if there's no individual consequences for private citizens, what is going to happen to sort of help businesses enforce the mask mandate in that case?
Thank you.
Did I mute myself? Sorry, no, again.
Ellen or Anna, I think that question would be for you if you could real briefly address that question.
If a person causes a disturbance for any reason, if it gets to that point, the business can, whether it's some sort of a scene or a disturbance or some other behavior, they can call the police. They can't call the police to say, I've got somebody here who doesn't want to wear a mask. They need to say, I'm going to let you in or I'm not going to let you in. Just similarly, I'm not going to let you in without shoes, for example.
All right, thank you, Ellen. Emily, Emmy, if you could select our next commenter.
Looks like Aaron Lipkin has a comment. Aaron, if you could unmute yourself.
Hello. I'm the Missoula County Superintendent of Schools. I'm elected to oversee the rural school districts in the county, among other duties. As many of you know, there are 13 school districts in Missoula County, the largest of which is our city district, Missoula County Public Schools, which educates approximately 50% of the K-8 students in the county. Primarily, I oversee Woodman and Sunset elementary schools, and I'm in charge of developing the school reopening plans for those two districts. I understand and agree with the need to normalize mask usage. I believe it's our obligation as a society to protect our most vulnerable members. I want to state that I fully support a mask order in Missoula County in almost all indoor settings. The only area I struggle with is the language that students must wear a mask in a school setting beginning at age 12. At Woodman School, we have approximately 36 students in 4 mixed grade classrooms in grades K to 8. At Sunset, we have approximately 17 students in 2 mixed grade classrooms K-8. In settings such as these, or even in districts with hundreds of students, there will always be classrooms with children who are 12 mixed with children who are 11 or younger. Additionally, there will be children turning 12 mid-year. The school becomes the enforcer keeping track of when children turn 12. I would like this order amended to read that masks are required in a school setting for children in grades 9 and up. I do support the rest of this order. Thank you.
All right, thank you. Emmy, if you could select our next commenter.
Jennifer Sweeten, could you unmute yourself? Or Sweaten, Jennifer
Sweeten. Yes,
Sweeten.
you got it right. Good afternoon. My name's Jennifer Sweeten. I'm the Director of Operations for Mountain Line. We've been requiring masks on our vehicles for quite some time now. We do fully support this measure to require masks anywhere outside of or inside businesses in Missoula. Thank you.
All right, thank you. Go ahead, Emmy.
Tom Stack, if you could unmute yourself.
Thank you. Can you hear me?
Yes, we can.
Okay. My name's Tom Stack. I'm the superintendent of schools from Clinton, and I'd like to kind of piggyback off of what Aaron said. I think if you're going to make a mandate, I think what schools were thinking about doing, or at least what we were thinking about doing in Clinton, was leaving it up to individual staff members and parents and students to wear masks or not wear masks as an individual right. So now with the mandate at 12, I really believe that, you know, if you're going to have split classrooms, and I think that's going to cause a parent saying, my kid's 11, they don't have to wear one. Another kid in the classroom's 12, they have to wear one. It'd be nice if you would say K5 or 12 years or younger, but split it up, because you're going to have, you're putting an issue in the school to lobby with parents, and I think you need to include a grade level, not just an age. Thank you.
All right, thank you.
Jim Howard, could you unmute yourself?
Yes, thank you. I'm Jim Howard, superintendent at Bonner School. And, you know, to me, the minute you have an age level mask order, the schools really become the front line of that discussion in large part across our county. And so I strongly concur with the recommendation made by County Superintendent Aaron Lipkin. And with that, I'd also say that on this key issue that impacts so many students, I think there was a limited amount of conversation or input from the various superintendents from the schools within the county. And so I hope you'll listen to us at this point and consider strongly that recommendation from County Superintendent Lipkin. Thank you.
All right, thank you.
Shauna Ryan or Reen, you can unmute yourself.
Thank you. It's Shauna Ryan, and I'm an executive assistant and office manager at a Woodman Source here in Missoula. We have been requiring anybody who comes into any of our 3 facilities to wear masks. We absolutely 100% support this mask mandate, and want to thank you for bringing this up and making this possible. Thank you.
All right, thank you.
It looks like Steve has a comment in the chat. That says, I am a proponent, but would like to hear explanation of the threshold for determining whether an operator refuses to enforce. What are the considerations or evidence that the health department would consider? How would it apply to UM, for example?
Ellen and Anna, do you want to tackle that for a minute?
I want to be really careful with the commenter's time and say that Anna went over what some of the more ultimate or stepwise enforcement actions would be, but we've been enforcing closures, partial reopenings, and our environmental health crew, the first thing they do with the complaint is they call the owner or the manager, and we start talking, we start educating. If that doesn't work, we learn something from them, we give a warning, and we take it from there. So it's very much to achieve compliance as our first order of business.
All right, thank you, Ellen. Emmy, do we have any more proponent commenters?
I do not see any. If you've already had your comment, if you could please lower your hand, that would be very helpful. Thank you.
All right, if we have no more proponent commenters that Emmy can identify, I guess at this point we will move on to public comment from opponents. And again, we'll go ahead and provide that 20 minutes. So Emmy, if you can get us started there.
Just like proponents, we'll do the same thing. Again, if you're on your phone, please feel free to call directly into the Teams application. You can either join on the web or download the app. So yeah, if anybody is an opponent, if you could raise your hand or put in the chat that you have a comment, that would be very helpful. Thank you.
Raise hand.
Could I, who was that said that?
This is Frank.
Are you on the phone, Frank? Or
yeah, I'm here. Should I ask my question?
Sure. Yeah. We're trying to do so. We're going in order of the raised hands, but since you're on, sure. Yeah.
Okay. I just wonder. I think this mask business is probably a good thing. No problem here. But how is this going to be enforced? That's what I don't understand. Are you going to write a statute on this? Something that can be enforced? Or is this, we recommend that you wear a mask, and is that as far as this is going to go?
This is Ross, the chair. Anna Conley's already gone over enforcement on this. It's not a recommendation. It is a rule. And if Ellen signs it as an order, it will also be an order. The enforcement will be directed to businesses and entities and owners and managers and occupants of public spaces and public settings, and they will be required to enforce this. So in other words, say a store owner will be required to require that all public entering their store wear masks and all employees entering their store wear masks. And enforcement, if a store decides not to do that, enforcement will be against the store. But it is a rule, and it does have enforcement teeth with it. Thank you. Emmy, if you could move on to our next commenter.
Laura Bramson, you could unmute yourself, or it looks like she also left a chat. So she said, I am an opponent, but have a question in a retail store setting. When there are no customers in the store, do the workers still have to keep masks on?
So this is Ellen, and the answer to that is if there is no public in the store, the workers have to wear masks unless they are maintaining a 6-foot distance at all times.
Thank you. Are there any other opponents who would like to raise their hand? And then we'll move on to the phones if there aren't. Okay.
May I ask a question?
I believe I heard somebody ask if they could ask a question.
Yes, my name is Mark. May I ask a question?
Sure, if we can keep it to 2 minutes, you can ask a question.
Be very brief. Sort of building on what you were just discussing, be it that it is on the owners and or management in a location to enforce this. I'm sure that you all know what kind of pushback we're going to be getting as a result. Do we have some sort of a fallback measure if we have a situation where somebody is refusing to comply?
Ellen or Anna, I'm going to leave that up to you to briefly answer that.
Well, whenever someone tries to come into a business with something that that business either by law or by desire does not want to have going on in their business, you ask them to leave. If they don't leave or cause some other scene, you can contact law enforcement. I will bring up that there are businesses that have been trying to require masks and are receiving pushback, in their opinion, because other businesses are not doing the same thing.
We have definitely been trying to enforce in our environment a policy where our guests wear masks when they come in, and it has just been continual battle, which, you know, I'm not an opponent of this. In fact, I'm looking forward to it, but we obviously need something to tell these people that listen, you know, if you're unwilling to comply, then we're going to have to call the police, or, I mean, are the police going to respond over a mask situation?
I can't speak for the police. I did speak with the police and the sheriff in advance. And when you tell someone to leave your business for any legitimate reason and they don't leave, then you would take the same steps if that includes.
Sure. Yeah.
Okay.
Of course. Okay. Thank you for your time.
All right. Thank you. Emmy, do we have any other?
Yeah, looks like Les Meyer. If you could unmute yourself.
Hey, thank you. I appreciate the information. I guess my question is not from a proponent or opponent standpoint. With that being said, we are a public entity and a public education where we have the right to educate. And I understand a business standpoint, because all the questions have been around a business. If somebody refuses in a public institution where we are mandated and it's a right for you to receive FAPE, a free and public education, and someone refuses, I guess maybe we don't. We may not have any issues. It's just, what if we do? And then it becomes a snowball effect.
Yeah, Anna, I don't know if you want to address that briefly or just leave it as a comment.
Hey, thank
you. This is Anna.
My question is not from a proponent or opponent standpoint. With that being said,
I don't know where we're at technologically here, if we lost that, or if
I
Anna,
think. Go ahead, Anna, on what you were saying. Yeah.
I would advise that we continue with taking comments as opposed to a question and answer on staff, given the time constraints.
Okay, thanks, Anna. So, Emmy, any other comments?
There is one in the chat that says, I am against the mask mandate. From Sandra Vaseka, and it says, I am against the mask mandate. I think it should be encouraged, but leave the businesses able to make their own decision. Also, if this does pass, will there be templates available for signage? And we have a couple others that kind of trickled in from the proponents. I don't know if you want me to go through those. There's one that says, Kelly is also a proponent, but I can't hear anything and couldn't raise my hand. And then we have one from Taylor Valiant that says, I am a business owner in town and I am a proponent of this rule. I had difficulty getting on before the proponents were cut off. And then there were some questions from Steve, who already commented. We'll make sure he gets the appropriate contact information he's asking for. So are there any other opponents who would like to raise their hand? Okay. Are we ready to move on to phones, Ross?
Yeah.
Sorry, I'd like to raise my hand.
Who is this?
My name is Jason Sorleen. My phone was muted by mistake. I just have one quick question. For office settings where we don't have the general public coming and going, with exception of parcel delivery, if they're able to maintain that social distancing of 6 feet or greater, are we going to be required to have our employees wear masks as well? Because it's a little bit different than retail.
Okay.
Yeah, Ellen or Anna, and I don't know if you want to address that real briefly.
That is covered in a general way in the rule. So if there is a member of the public, then they have to have their mask on. If they're by themselves, just doing their work as an office setting, they're required to have the 6 foot distancing.
Thank you, Ellen. Any other commenters, Emmy?
There's one in the chat that says, hi, I'm a Valley Christian's private public school board chairman. How do we legally know if this applies to our private school?
It's indoor, it's in Missoula County, has children age 12 and up, it's required.
Okay, any others on Teams who would like to raise their hand in order to comment, please do so. If not, then we will move on to phones. Okay.
Hello? Hello?
Could you please state your name?
Elena? Can you hear me?
Yep.
Great, thank you. Okay, I'm a opponent. I'll get that off the start. But when you gave your 4 conditions, I didn't notice anything about people who have health problems that can't wear a mask. Also, when you go to a restaurant, I believe you have to remove your mask to eat. Does this virus take a lunch break?
Thank you for the comment. I believe the rule as written does address those issues. So with that, I think we can go to the next comment.
I didn't hear it.
You need to read the rule. It's in the rule.
I heard the 4, and one of them was 12 or older, and nothing about people with health problems.
Again, it's written in the rule. We didn't read the rule in its entirety. It's written in the rule, and that's provided to the public. With that, Emmy, if you could move on to our next commenter.
Okay.
Hello?
There, one more. Okay. Okay, I guess we'll move on to phones then. This is kind of tough to do with phones because we don't have a way to stop people from talking over one another. I'll just briefly go down the list and call out a phone number. If that is your phone number, please unmute yourself and give a comment. If we don't hear anything, I'm going to assume that you don't have a comment. So okay, first phone number is 402-540-6013. Do you have a comment? And if you do, please unmute yourself.
Hello? Can you hear me?
Who is this? Could you state your name? Okay, I'll move on then. Okay. So next, I'm going to move on to the next phone number. If you're somebody on the phone, please know I will get to you down the list. So next phone number, 406-214-7591. Do you have a comment? Okay. Next one, 406-239-9929. Do you have a comment? All right. And please make sure to know that you are muted, so you will have to unmute yourself to comment. Next phone number, 406-303-0466. Do you have a comment? Okay. Next one, 406-360-6830. Do you have a comment?
Hey, Emmy, this is Cindy. Can I make a suggestion that you tell people on the phone how to unmute themselves? Because I think they have to push a certain button, like a number, to be able to unmute.
Yeah,
I believe it's *66.
That's good to know. I didn't realize that was part of the phones. Thank you. Yeah, so if you can unmute yourself that way, that would be the way to do that. So 30.
My phone number was called, and I didn't know how to unmute myself, but I'm 303-0466.
Okay, thank you.
I just have a question or a comment, I guess. If you guys really think it's wise to bombard our 911 dispatch system with people calling in regarding other people not wearing masks, I think the police have better things to do than respond to petty calls like that. Thank you.
Thank you. Go ahead, Amy.
Okay, are any of the other phone numbers that I called, if you figured out how to unmute yourself, I apologize for that. You feel free to do so now. Okay. So next phone number is 406-438-5740. Do you have a comment? Okay. 406-447-3041. Okay. 406-523-2500. All right. 523-3989. Does 406-529-9685. Okay. 406-531-2606. Four 531-8783. Is there someone who just joined who has a comment?
I don't know if that's me.
Do you have a comment?
Yes.
Feel free to give your comment for 2 minutes.
Okay, the first thing I wanted to mention is that I'm very offended by the fact whoever is making these comments about they want to normalize mask wearing, I think it's very irresponsible, number one. The President of the United States has said he's left this up to individual states to make recommendations based on the CDC recommendations by state, depending on the severity of the outbreak. In Montana, we are the second lowest cases of deaths with coronavirus. When you look at the statistics of the flu in Montana, the coronavirus has not even been as bad as the last 4 years of the flu in Montana. So I'm very concerned that we're normalizing masks for something that's not even as bad as the flu in Missoula, Montana. And that's why there's the flexibility with the CDC to recommend, not mandate. And also why the president is saying he is not going to make an executive order regarding masks because it's best left up to each individual state depending on the severity within their state. Now, I don't see any reason to legitimize anyone mandated to wear a mask, even in schools, when there's so much evidence of possibility that this could be more dangerous than it is good, including Dr. Fauci making comments and the Surgeon General making comments saying that these masks are not effective, not only for helping the person wearing it, but for preventing the transmission of it, because masks are often worn wrong. And they say that if air can get through, so can a virus. That's how small viruses are. Now, I want to pose to you some questions. Do used and loaded masks become sources of enhanced transmission for the wearer and others? Do masks become collectors and retainers of pathogens that the mask wearer would otherwise avoid when breathing without a mask?
I just want to let you know that 2 minutes is up.
Okay, well, I have a comprehensive letter that I didn't get to you because I was having trouble with my internet. And I would hope that you would wait to receive my letter before you would make any determination on this, because I think to do so would be irresponsible given the fact that the dangers of masks are not being addressed whatsoever at all.
All right, thank you for your comment. Em, if you could move on to the next commenter.
If there's any of the phone numbers that I already called out, feel free to unmute yourselves at this time if you have any comments. And at this point, I might just, instead of calling out each number, because that is a little cumbersome for some folks, if you could unmute yourself and give your comment and you're on the phone, we'll try to organize you from there. I'll see who is talking by the number that lights up. So feel free to. Okay. Hi. Could the first lady speak? Could you tell me your name?
Hi, yes. My name is Leticia Romero. I'm calling here. I live here in Missoula. I just wanted to comment and just, I'm for mandating masks. I think they're really important. A lot of health officials are recommending it. And I really would like for our city officials and everybody to take heed of nurses, doctors, and other scientists and their advice and what they're saying. Just to listen to them, as other nations have listened to them. The nations that have listened to health officials are faring better with COVID infections. And I think it's just the best thing to do is just to listen listen to the people who've actually gone to school, are educated on this, and that's just the best thing to do. Whether or not we're inconvenienced or other such things is the least that we can do to take care of each other. Yeah, I think that's all. I work in a warehouse of more than 100 people here in Missoula, and they have not worn any mask since March, and I've been the only person wearing mask, and it's been super stressful. And up until last week, because we had a positive COVID infection, they started wearing masks after the fact, and really loosely too. And so it's just been pretty stressful. So it'd be a good thing if we could have that. Like I said, it's not that inconvenient, and just listen to health officials, doctors. Those people are the ones we need to be taking advice from, not from people who never went to school for this. So,
All right.
Thank you.
Thank you. Okay, that pretty much jives with 2 minutes as well. So thank you for that comment. Emmy, if we have any other commenters. We're actually getting close out of time. How about we could have time for one more commenter, Emmy? I think then we're out of time.
This is Emmett.
Excuse me, this is Kimberly. Oh, sorry.
Okay, I heard Emmett first, so let's hear from Emmett.
This is Emmett. Am I on? Hello?
Yep, I can hear you.
Okay, excellent. Well, I'm against the mask ordinance. It's a civil liberties issue. I mean, we've had this. I don't know. The survival rate is very, very high for this new contagion, and most people do recover. And I just feel that it's almost like a psychological operations to see, will we comply? Will we not? I won't have a choice but to comply if this is adopted. But I do feel it infringes on not only civil liberties, just personal responsibility. If you want to wear a mask, go ahead. If you don't, that's fine. I'm kind of more of a libertarian on this issue because I just think it's just personal responsibility and personal freedom. We live in a free country, or we used to, and we haven't even done this like one of our previous callers for the flu. We have much more flu here in Montana than we do COVID. So those are my comments. Thank you. Bye-bye.
Thank you. With that, we're pretty much up against our time limit, and so I think that's all the time we have for comments. Emmy, is there a way that people that didn't have a chance to verbally comment can notify whether they're an opponent or proponent, or tell me where we're at with that technology?
Yeah, if you didn't get a chance to verbally comment and you're on Microsoft Teams, feel free to type it in the chat. If you're on the phone and you didn't get a chance, you can submit, I believe you can, and Mary Parrish, please correct me on this, but I believe you can still submit comments to the Health Department's comment portal, and you can find that by visiting the Missoula County website and clicking at the link at the top labeled Submit Public Comment on Proposed Rule. So you can still submit comment there.
All right, thank you, Emmy. And with that, the public comment session is closed, and because of time constraints, and thank you everyone who did comment. We really appreciate those comments. And with that, we've got a motion on the floor. It's the motion on the floor is the proposed Missoula City County Board of Health rule to pass that rule as is, not unamended. And with that, I think we are ready to take a board vote on the rule. And I think how we'll do that is I will go around and query each board member for a yay or a nay, or for or against, and to make that clearly. And we'll go through each of us 7 board members in that manner. So I guess to get started, Amber put the motion on the floor.
Yeah, Ross. Ross, this is Amber. Can I ask a procedural question really quickly?
Sure.
I would, and I don't know how exactly we do this in this format, but I would like to make at least discuss an amendment to the motion that I made. Is that possible now?
Well, I don't believe it is, and chime in if I'm wrong, Anna, but I don't believe it is because we open it up for public comment for the motion as it stood. So if we amend it, then the public hasn't had a chance to comment on it as amended.
So one of the, let me just, before we talk about the one amendment that I was thinking about was what the schools brought up and the confusion of having two, an eighth grader is, 13 and 14 when they're in eighth grade, and a seventh grader is, 12 and 13 or whatever, generally, of course. So I'm wondering if we could just add sixth grade or 12 years old, because that would make it clear for the school. So that, just so you know, I'm not making some major amendment to it, but I guess it would still apply.
And I'll chime in on that. And again, you feel free to chime in, Ellen or Anna. My understanding on that is what the question really is and what the issue really is burden shifting. Who's going to make that? Who's going to make the policy for how a given school handles that question? What we heard is a few schools calling in that want the health board to answer that school policy decision for them. The schools have the complete ability and authority to answer that policy decision on their own. In other words, they can look at the rule and they can figure out how to create a school policy that complies with that rule. So, it's basically a burden shifting issue. Who's going to create that rule? Similar to that, we, the health board, and the health department are creating this rule as opposed to our governor. So as opposed to a state rule. So if you start going down that path, it's a slippery slope. You keep running into who's got the responsibility to figure out how to best implement the rule. I don't know if Ellen or Anna, if you want to chime in any more on that or not.
I'm looking to Anna because we did discuss that.
Yeah, I would advise the board not to adopt school-specific amendments to this order. I think if a school setting falls within the definition of public indoor space, then accordingly the school administrator can address that situation specific to the school. So that's my 2 cents. I'm concerned because I think the school has a number of considerations that are education specific that they need to be thinking about under their own set of powers and authorities. And so I would prefer that rather than start to parse exceptions that are specific to contexts and types of situations, that we stick with the definition that we have set forth in this draft.
And they would have the ability to mandate that for their own school. Is that correct?
Absolutely.
There's no limitation on a school creating a policy for younger ages.
Okay, then I won't amend it.
All right, thank you, Amber. With that, I believe we have a motion on the floor to adopt the rule as drafted and as currently available and provided before the meeting on the county website. So again, we'll go around. I'm going to go around to each board member for a vote. I guess I'll start with Deb.
Aye.
All right, then Rob.
Aye.
All right, then Pam.
Aye.
Thank you. And then James.
Aye.
All right, and then Josh.
Aye.
All right. I myself am an aye. and Amber.
Aye.
All right, thank you. The motion passes unanimously with all 7 board members voting aye. With that, we have passed and enacted the rule on the face covering rule. So with that, we've wrapped up the business. I guess we got 2 more quick items. And that would be for public comments on items not on the agenda. We probably have about 2 minutes to address public comments on items not on the agenda.
Actually, Ross, I just have to state, as it shows on the order of proceedings, that I will issue the health officer order. Concurrent with this, I will add to the health officer order the recommendation related to younger age groups wearing masks. Thank you.
Oh, thank you, Ellen. Sorry, I jumped out of order on that. So with that, we've got a Board of Health order on face covering, excuse me, a Board of Health rule on face coverings under the board's statutory authority. And we've got a health officer order on face coverings that is kind of a companion and pretty much the same as that rule under the health officer's statutory authority. So we've got just a couple minutes for public comments on items not on the agenda. And Emmy, I don't know how you're going to do that, but I'm going to ask you to.
Yeah, if someone just wants to speak up if they have comment that's not on this agenda, that would be great. I don't know of a better way to do it, so.
Yeah, understood. Are we hearing any requests for comments, Emmy?
I don't see any hands raised or any chats for anything that is not on this agenda, so.
All right, thank you. Then we'll move on. Any board or staff comments on items not on the agenda? And I'm not seeing any requests for comments from board or staff on items not on the agenda. Emmy, are you?
No.
All right. With that, we will adjourn this special meeting of the Board of Health, and we're done and adjourned. Thank you, everyone, and thanks Emmy and the rest of the health department staff for helping us through this technology and holding a virtual meeting. Thank you, everyone.